In this video, a nurse will understand the various aspects of the bandaging technique, steps of procedure, article required, aftercare, and most importantly, what to do when things go wrong. In other words, the common clinical errors. It is a strip of material which is used to immobilize and support the injured part of the body. Bandaging is a process in order to protect or cover the wound. So next we are going to discuss about the purposes of the bandaging. There are various purposes of bandaging such as to protect the wound from contamination, to apply the pressure, to protect the wound from the hemorrhage and to protect the wound from the infection. So next we are going to discuss about the various types of bandaging. The types of bandaging are as follows, that is circular bandage, spiral, reverse spiral, spica, figure of 8, jaw, Kaplan, abdominal binder. Jaw bandaging. A narrow strip of material above 31 by 2 feet longer and a narrow fold or a triangular bandage can be used for the jaw bandaging. The jaw bandaging is used to limit the movement of the jaw. So next we are going to show you the demonstration of the jaw bandaging. Equipments required: a tray containing loose gloves, appropriate bandages, scissor, adhesive tape, dressing material like gauze, kidney tray. Introduce yourself to patient.
Good morning, sir. This is Shilpa, your science staff from 8 a.m. to 2 p.m. Sir, may I know your name?
Check doctor's order sheet. Explain the procedure to patient.
Sir, now I am going to apply you a jaw bandage.
Perform hand rub. Wear loose gloves. Select the bandage of proper size and material. Position the patient. Remove all foreign material from the casualty mouth. If the casualty is unconscious, check the obstruction in the airway. Place the bandage under the chin with one end longer. When applying the bandage, allow the jaw enough freedom to permit passage of air and drainage from the mouth. Take the longer end over the top of the head to meet the short end at the temple and cross the ends over. Take the ends in the opposite direction to the other side of the head and tie them over the part of the bandage that was applied first. Tie the end above the ear. Aftercare. Discard the waste according to biomedical waste management policy. Perform hand hygiene. And document the procedure in nurse's notes. Key points to remember. Always check for the correct size and type of bandaging according to the location of wound. Bandaging should not be too tight so it can interfere with the blood circulation.